Welcome to another Wealth Guide IQ video. Here at Wealth Guide, we help connect individuals with financial advisors we believe are both trustworthy and capable. In today's video, we're going to be covering Medicare Part A. Now, Medicare has multiple parts. We're only covering Part A, and we're going to cover three specific aspects, which are enrollment, cost, and coverage. So without further ado, let's dive in. So here we are at Wealth Guide IQ. We have a nice calculator here that'll go over things like coverage, also defines a lot of the terms for Medicare Part A. As we dive in, let's talk about what Medicare Part A is. First of all, as you can see here, it covers inpatient hospital care. Now, that definition of inpatient hospital care is a little bit nuanced. It really means that you received food or lodging or stayed in the hospital for a longer duration of time. A really simple way to think about it is if you have overnight stays at a hospital, that would be covered under Medicare Part A, and the coverage is phenomenal. Now, when we talk about overnight stays, the reason is technically you received food and lodging. You could be in a hospital overnight, but it's technically not inpatient care. For example, let's say you broke your leg at 9 p.m. in the evening, went to the hospital, and you were discharged at 6 a.m. in the morning. You were technically there overnight, but you didn't really stay there. You didn't receive lodging. You just happened to have a medical event that was outpatient care that occurred in the evening. So inpatient care is when you're there for an extended duration of time and you're lodging in the hospital. Medicare Part A covers that. And it's a very good thing that it does, because overnight stays and lodging in the hospital are very expensive. So that's what Medicare Part A primarily covers. There's a couple of other elements like skilled nursing facilities. We're not going to get into that, but this is the bulk of what is covered here. Now, when we look at the cost of Medicare Part A, you can see that for about 99% of Medicare beneficiaries, they have no monthly premium, meaning this is free for 99% of the plan participants. In order for it to be free for you, you have had to pay Medicare taxes into the system over the time that you worked. And for most individuals that are eligible, over 99%, they have no monthly premium. Now, the fact that this basically costs nothing for almost everyone who's eligible impacts our enrollment strategy, which we'll talk about here in a moment. There are 3 times that you can enroll for Medicare Part A. I'm going to cover them briefly. You have what's known as the initial enrollment period. This opens up 3 months before you turn 65 and then lasts 3 months after you turn 65. This includes the month that you do turn 65. So it's a total of 7 months for your initial enrollment period. If you are younger than 64 and 9 months, so you have not started your initial enrollment period yet, we believe it would be beneficial to apply during the initial enrollment period. The reason for this is because for 99% of Medicare participants, they pay nothing to be on Medicare Part A. So if you have a job or do not have a job, or you're covered under other medical insurance or not covered under medical insurance, enrolling in Medicare Part A during the initial enrollment period is generally a good strategy because it doesn't cost you anything. So that's the initial enrollment period. If you miss the initial enrollment period, let's say you were employed and decided not to apply for any parts of Medicare during your employment, you may still be eligible for the special enrollment period. There are a wide variety of triggers that activate this special enrollment period, but the most common one by far is that you had a job that provided you with insurance coverage. If you fall in this bucket, you are able to apply for Medicare Part A during the special enrollment period. This begins basically when your initial enrollment period ended, all the way up until 8 months after you either no longer are employed or no longer received medical coverage under your job, whichever is first. The special enrollment period, basically 8 months after you're done working. Again, definitely recommend enrolling during the special enrollment period because, again, it costs you nothing for Medicare Part A. So if you're still working, you have a job, you're over the age of 65, you actually can go ahead and enroll in the special enrollment period right away because you're in the special enrollment period. General enrollment, we are not going to cover, but effectively, you can sign up anytime if you miss these two windows between January 1st and March 31st every year. That's called the general enrollment period. If you miss the initial and special enrollment, you go ahead and do that. There is a chance that you may pay a late penalty for enrollment if you missed these two periods. Once you are successfully enrolled in Medicare Part A, you're not paying any costs, usually for 99% of plan participants, to be under that coverage. What is actually covered and how does it work? So let's take a look at that. There are two things that you are going to pay out of pocket under Medicare Part A if you have a medical event. The first is known as the deductible. Anytime you have insurance, you generally have a deductible, which is you paying first before the insurance kicks in. For Medicare Part A in the year 2024, your deductible set at $1,632 per benefit period, which we'll talk about here in a moment. But the deductible means that you are going to pay the first $1,632 of medical expenses if you have a medical event covered under Medicare Part A. There's ways to avoid that if you get supplemental insurance, which we'll talk about in another video. After you pay your deductible and the medical bills continue to climb, your insurance kicks in and Medicare Part A is going to cover that. And again, the coverage for this is pretty phenomenal. In the event that it's not covered, you would have what's known as coinsurance. Coinsurance is the amount that you pay alongside of your insurance provider. So you're going to pay one of two things. First, you're going to pay the deductible, then you're going to pay coinsurance. So let's take a look at the calculator we have here for Medicare Part A out-of-pocket costs. For your out-of-pocket costs, it's going to be determined by how much it costs for you to stay in the hospital and how many days you were in the hospital. You kind of multiply those two things and you get your overall medical bill. Way more complex than that, but this will illustrate the point quite well. So the first thing we need to know is how much is the daily cost of a hospital visit in the United States. It is roughly $3,200 per day, but this varies wildly depending on what type of hospital you're in, what region of the country, and many, many other factors. But for the sake of this illustration, this number will work quite well to understand your out-of-pocket costs in the event that you have a multi-stay visit for inpatient care at a hospital. So we're going to use this number, $3,200 per day. That would be your cost for this medical event if you didn't have medical insurance. If we scroll down here, we're going to take a look at what we call the first medical event. Something happens to you and you are in the hospital. It kicks off what's known as a benefit period. So you see here, we're in benefit period 1. You go to the hospital. I'm going to go ahead and set today's date, which is January 9th. Let's say that we go into the hospital and you are in the hospital for 1 day. On the right-hand side here, we have two numbers. We have what you pay out of pocket and we have what Medicare pays. These two numbers add up to the $3,200 daily visit. So between the two of you, Medicare Part A and your out-of-pocket costs, the hospital gets paid. The amount that you pay for a 1-day visit in the hospital is equal to your deductible. You can see here, this is $1,632, which is the Medicare Part A deductible. Anything past that, you have 0% coinsurance, and Medicare Part A pays everything. 0% coinsurance means that you're paying nothing out of pocket for anything past the deductible. So Medicare picked up the rest of the bill. That 0% coinsurance, where there's nothing out of pocket for you, remains true for the first 60 days. So watch what happens when I increment this up 1 day. If we go up 1 day, you still only pay the deductible for this entire medical event. Nothing changed for you if you stay an extra day. Medicare picks up the rest of the bill, all $3,200. That remains true for the first 60 days. So if I increment this again, you still only pay your deductible amount. I'm going to go ahead and change this to 60, and you'll see that you still only pay your deductible amount. So you are fully covered, 0% coinsurance, only your deductible amount for the first 60 days in a single benefit period. Medicare pays the rest, and it's a good thing. You can see how expensive a 60-day hospital visit would be at $3,200 per day. Now, at 61 days, your coverage changes. You now have what's known as coinsurance, and you have to pay a certain amount out of pocket if you stay over 60 days. When you hit day 61, you're going to pay $408 per day. So I'm going to increment this back down to 60. See, we're still at the deductible. That first day over 60, this is going to go up $408. The rest of that bill, Medicare picks up. So your coinsurance is $408 per day, and Medicare covers 100% of the rest. That's true from day 60 until day 90. So I'm going to go ahead and type in day 90. That just incremented up $408 per day, every day between 60 and 90. Excuse me. Now, at day 90, it's another break point for Medicare Part A, and things change again. You're going to go from paying $408 per day to $812. So if I increment this up one day, this goes up $812, and Medicare picks up the rest. But you can see your out-of-pocket cost is really starting to increase at day 91 in a single benefit period. Now, something interesting also happens at day 90. I'm going to go ahead and increment this back down to 90. You can see here, this says lifetime reserve days. When you're on Medicare Part A, you have a total of 60 lifetime reserve days. A lifetime reserve day means if you're in a benefit period and you go over 90 days, you're using up one of your lifetime reserve days. So when I increment this up to 91, you can see I have 59 days left of coverage where my out-of-pocket cost is $816. So that coinsurance of $816 that we mentioned kicks in at day 90. It only works for 60 lifetime reserve days. And we'll talk a little bit more about those here in a minute. But every day you're in past 90 in a single benefit period, you're using up one of these lifetime reserve days, and you're paying $816 more. So as we increment this up, that starts to go down. If we get to 150, you'll see we are out of lifetime reserve days. That's 90 plus 60. So we've used all of the lifetime reserve days up. When you hit day 151 in a single benefit period, watch how much Medicare is paying. They're at $417. See where you're at. If we increment this up one, you'll notice Medicare didn't move at all. Once you're out of lifetime reserve days and you're past day 90, in this case it's 150 because we had to use all the lifetime reserve days. But when you hit day 151 for your first benefit period, you pay everything. And so like the next 10 days, if we go to 160, you can see that added a huge amount to your out-of-pocket costs. So Medicare Part A is phenomenal coverage. You only pay the deductible from days 0 to 60. 61 to 90, you pay $408 per day. Day 90 to 150, as long as you have lifetime reserve days left, you pay $816. If you run out of lifetime reserve days, you pay the full amount. Now, that may sound scary and the bill definitely gets large, but it's really important to note that a hospital stay where you're actually staying overnight for inpatient care of this duration is incredibly rare. The average duration of inpatient care is usually between 4 and 5 days, so you're way inside that 60-day window where everything is covered. Additionally, a coma, which is one of the kind of longest duration inpatient care events that can happen to people, generally only lasts a few weeks. And so that's usually well within that 60-day window. So this duration of 60 days with 100% coverage other than your deductible, and then great coverage from 60 to 90, it really covers the overwhelming majority of inpatient care events. So these numbers shouldn't be as scary as they look, because the number of days in the hospital is generally going to be around 4 or 5, or in a rare case, 28 days, etc. You're still covered. So this is phenomenal coverage for each benefit period. And in addition to that, you can buy supplemental insurance coverage for these extremely rare events. And a lot of times that coverage is quite affordable and can be very beneficial to you. So that's it for our video on Medicare Part A. We are going to do a follow-up video on lifetime reserve days and the benefit period. Those are slightly more complex topics. You can find a link in the description below to that video. If you're an individual that's looking for a financial advisor that we believe is both trustworthy and capable, feel free to reach out to us to schedule a free consultation. If you're an advisor that believes you can qualify for Wealth Guide IQ, feel free to give us a call. Thanks.